Hi, Dr. Edmond. My name is Lucy and I'm calling from Orlando, Florida. My question is, when seeking mental health counseling for minor children, is it absolutely necessary that the parent has to seek mental health counseling as well? I'm only asking because I've sought mental health counseling for my children in the past because of the trauma that they had been going through or that they had gone through, not realizing that their trauma was my trauma just by default, from being their mom. I felt I felt a lot of what my children felt. So do you think that it's an absolute that the parent has to seek mental health counseling as well when a minor child has to?
Hi, Lucy. Thank you for your question. It is such a great question and shows sheer proof that you are a great mom who cares about yourself and your children. When seeking mental health counseling for minor children, it is necessary for the parent of the child to seek mental health counseling as well if the parent is experiencing the same or even different signs and symptoms of mental illness of his or her child. People with a mental illness do not necessarily have relatives with the same illness, but there is research that suggests that mental illness can run in families, and the parent's behavior toward the child is most of the time adversely affected as a result of the mental condition or situations that cause mental stresses within the family environment. Therefore, mental issues with the children can be reduced if the parental issues are successfully addressed and treated. Consequently, a mental health evaluation for both the child and the parent is often essential to understanding a child's mental illness, if one exists. It is therefore common with therapy for a minor to include the parent, especially when the child is very young. Therapists sometimes work with the parents alone. However, they tend to often observe the parents and the children together to get a better understanding of how the parent and the child trauma could possibly be related. Children cannot be expected by themselves to have the tools and skills to overcome mental illness challenges on their own, but they can successfully recover with the help of their parents and an effective diagnosis and treatment plan. I hope I answered your question, Lucy. Thank you. Bye bye.